So good morning. My name is Linnea Webb. I'm a project manager here at the Swetland Center for Environmental Health at Case Western Reserve University. I help coordinate the Swetland seminars that we have here every month. Um, Please, if you can, share your name and the organization you represent in the chat box. We always love to see where people are joining from. And if you're not familiar with the Swetland Center, back in the late 1950s, David Swetland and Marianne Swetland felt not enough was understood about unintended health consequences of chemical, agricultural, and industrial products in our environment. So they focused the Marianne Swetland Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards so that all graduating doctors would have an interest in and understanding of the impact of the environment on human health. And so today, the Swetland Center continues Marianne Swetland's legacy by building partnerships to find and scale solutions to redress the environment's disparate impact on low resource populations in Cleveland and beyond. And as research continues to demonstrate the vital connection between the environment and health, our center is positioned to respond. And our mission is to study the complex interplay between environmental determinants and population health outcomes. And we place special emphasis on community engaged approaches that address the role of structural racism in creating and sustaining environmental health inequities. And we seek to translate these findings into policies, practices, and relationships that promote community and population health equity. So if you're interested in learning more about the Swetland Center, you can check out our website at case.edu/Swetland. We'll put all this info in the chat. You can also email us at swetlandcenter@case.edu. And our values, racial justice, inclusivity, innovation, community engaged approach, and we're also collaborative. Okay. So as I mentioned, this Swetland seminar is a monthly event. Typically we have it on Zoom, but next month we are going to be having an event that's in person only. We're very excited to have Loiter Cafe and Marketplace is going to host the seminar next month. And the title is From Understanding to Action, Shaping Food Policies to Realize Nutrition Equity. So that'll be Tuesday, October 29th from 9 to 10:30 at Loiter Cafe and Marketplace in East Cleveland. I'm going to put the registration link in the chat, or you can scan that QR code or go to that link that's listed here on this slide. This seminar is also going to be co-sponsored by the Case Comprehensive Cancer Center. So join us for coffee and snacks for a conversation with Ismail Samad, co-founder of Loiter, about local food policy and nutrition equity. I think we have just one more announcement. So we are currently hiring for a SNAP Ed program manager. This is a full-time position that will be serving folks in Cuyahoga County, Ohio. They'll work closely with the Ohio SNAP Ed program led by Ohio State University and provide leadership in hiring, training, coaching, and supervising at least 5 SNAP Ed community nutrition educators at Case Western. And candidates must have at least 3 to 5 years of supervisory and related experience and a master's degree or higher. Applications are going to be reviewed on a rolling basis, and our goal is to hire someone by November 2024. So there is the I'll add this link at the bottom to the chat, as well as that direct link to the application. Okay, Darcy, I'm going to turn it over to you to introduce our presenters.
Great. Well, good morning, everybody. It is wonderful to be here. As I mentioned briefly to Liz when we got started this morning, Dr. Yamo and I had the opportunity to hear Dr. Yi present at a meeting about fruit and vegetable incentive programs in Alabama last October. And ever since I heard the talk, I felt like it was really important that we are able to share what you're learning in New York City with our broader community here. So thank you all for being here. I'd like to introduce our 2 presenters today. First, we have Liz Dowd, the partnerships project manager at Brooklyn Grange Rooftop Farm. Liz was born in Vermont and spent their youth tagging along their parents' never-ending gardening projects. Liz picked up some hard skills, but mostly how to trust your intuition and have fun doing it. Upon moving to New York City to study photography at the School of Visual Arts, they found that they loved the culture but missed the dirt. Their yearning for soil and seeds led them to the Pfeiffer Center, where they studied biodynamics, and NY Open Center, where they dove into urban permaculture. Then, after completing their adult urban farm training program, Liz was offered a co-manager position at the youth farm, where they found themselves energized and inspired by teaching and learning from their cohort and the challenging discussions about food justice that regularly took place. It was this framework that inspired Liz to begin growing for their community at the Brooklyn Grange in 2016. Since then, Liz has helped start Brooklyn Grange's Equitable Food Distribution Program, launching a sliding scale CSA, and working with funders to sponsor culturally relevant produce distribution to community-based organizations. And Stella Yi is an associate professor at the NYU Grossman School of Medicine, Department of Population Health. Dr. Yi is a researcher focused on health equity and social justice for Asian American and immigrant communities. Her specific content area expertise is on community-partnered and culturally relevant initiatives focused on nutrition and eating, cardiometabolic disease, the collection of disaggregated race and ethnicity data at the local and state levels, and application of inclusive research practices. Dr. Yi received her master's in public health and chronic disease epidemiology and social behavioral sciences at the Yale School of Public Health, and her doctorate in epidemiology from the Johns Hopkins Bloomberg School of Public Health. So thank you, Liz and Stella, and we look forward to hearing your presentation.
Okay, thank you, Darcy, and thank you, Linnea. Let me go ahead and share screen. Good morning, everybody. Okay, let's see. Let's go. I don't know why it's so hard every time. All right, there we go. Okay, can you see that? Okay, great. Thank you, Darcy. Okay, so good morning, everyone, and thank you so much, Darcy, Linnea, for inviting us to be present today to share our experiences with Harvest Share. Just to give you a sense of how the flow of this hour will go, I'll start out by sharing from the NYU and the research side of things on the Harvest Share program, and then Liz is going to follow with their perspective from the Brooklyn Grange side. Okay. So just to introduce Harvest Share, our Harvest Share program is a partnered program across NYU Grossman School of Medicine and 9 farm and community-based partners, 2 elementary schools, and consultants specializing in language justice and social marketing. Harvest Share is an equity-centered, multi-level strategy to improve diet for immigrant communities in Sunset Park, Brooklyn. And our program is designed for English, Mandarin Chinese, Spanish, and Bangla speakers, and is ongoing for 5 years. Just lastly, Harvest Share is funded as the BASIS grant. So BASIS stands for Building Access to Food Through Systems and Solidarity. And it's an R01 that specifically calls for community level intervention and outcome assessment. Okay. So just to start off with some health background, Latine and Asian American communities each face cardiometabolic disparities related to diet, but in slightly different ways. So the Latine community, for example, experiences a high prevalence of obesity, an increased risk of diabetes and non-alcoholic fatty liver disease, or NAFLD. And the Asian American community, on the other hand, experiences a low prevalence of obesity, yet is burdened at a similar magnitude as the Latine community with regards to both diabetes and non-alcoholic fatty liver disease. And for those of you who are not familiar with this area, approximately 45% of cardiometabolic deaths are estimated in the United States to be attributable to poor diet quality. So it really makes sense for us to be focusing on diet when it comes to cardiometabolic disease. But despite the importance of nutrition and cardiometabolic health and these disparities that are observed in Latine and Asian American populations, there is mounting evidence of the deficits in knowledge, programs, and research that address diet in underrepresented communities. And these deficits have been highlighted by our group and also by the NIH Nutrition and Health Disparities Implementation Working Group in their recent review. We also know that popular recommended dietary patterns, policies, and diet research do not necessarily serve the needs of diverse communities. So I'm sharing 3 commentaries that were led by 3 wonderful doctoral students. Now they're all doctors, Vivian Wang, Jin Park, and Shamir Ali. And I'll briefly touch upon some of the key findings from each of these works. So first, Vivian led a deep dive of some of the common dietary recommendations, and they're listed here, and to what extent these recommendations are potentially culturally adaptable. And what we found here is that the different dietary recommendations differ in terms of their origin and evolution, but they all tend to have a reductionist emphasis on physical health only. And they also may set aside some practical considerations, such as available resources, how food is procured and prepared, or potentially not honor existing plant-based or other social and cultural practices. In the second piece, Jin enumerated how transportation is a central determinant of food insecurity amongst immigrant communities, as is access to in-language resources around nutrition and SNAP WIC enrollment. And lastly, Shamir discussed areas in which we may consider modifying methods to promote greater inclusivity of the dietary experiences of immigrants within research, including understanding that immigrants prioritize ethnic food outlets, dietary behavior differences within families, or meal styles and patterns that are not currently recognized in mainstream narratives. So to summarize, all of this evidence really points to the fact that we need programs that help to improve nutrition and diet along the life course to prevent cardiometabolic and future disease amongst immigrant communities, and importantly, that incorporate cultural preferences, social determinants of health pertinent to immigrant communities, and that use inclusive framing, approaches, and methods. So this is a giant slide, and we're gonna go through each of these, mostly focusing on the orange section that really shows you the formative work that went into the development of Harvest Share. We did this at multiple levels. So just to kind of orient you to this figure, multi-sector partners are at the top. We did assessments at the neighborhood level amongst community members, and we also looked at the evidence and practice base. So I'm gonna focus a little bit more on the multi-sector partner work, and then we're gonna come back to this slide and talk about the other levels as well. So some of the rapid pivots, sorry about that. Some of the rapid pivots that our partners made during the peak of the COVID-19 pandemic are really important to start out our discussion in terms of how we developed Harvest Share, because these pivots were really part of the foundation for this work. So as a first example, Steve May and his team at the Chinese American Planning Council rapidly developed a food distribution system that included hot meal delivery and distribution of 180 produce boxes each week for older adults. Liz at the Brooklyn Grange, which we are going to learn more about, and is a rooftop company, a rooftop farm company, worked with Katie Bart at the Table at NYU Langone Health, which is a food pantry that's embedded in our healthcare system, to respond to the growing need for Chinese-specific produce amongst the pantry clients. And lastly, Michelle Hughes and her colleagues at the Glenwood Center for Regional Food and Farming, which is in the Hudson River Valley, north of New York, engaged in a number of activities exploring new payment systems for fresh produce boxes to be more appealing to lower income folks and those on SNAP, upfront support for small farmers in the form of a food sovereignty fund, and also making direct linkages between food pantries and farmers. On our end, in terms of multi-sector partners at NYU, we also wanted to read the pulse of other local stakeholders. So to do this, we held a series of 5 group model building workshops with 14 multi-sector partners to understand how we could promote healing from the pandemic amongst immigrant communities through food and nutrition programs. So we had a series of 5 workshops. They were from November 2021 to January 2022. And in terms of findings, we were able to identify a shared priority, which was to embed culture and other individual level preferences and identity into all levels of the food system, not just the food items themselves. And we identified common health outcomes of interest, including food security, health, and well-being, community capacity building and empowerment, and food waste as well, for areas of collective action. And all of these activities centered around 4 pillars, which were nutrition education, food access, policy change, and experiential learning. So I just wanted to pause for a minute and talk a little bit more about the group model building. Group model building, for those of you who are not familiar, is a system science technique where you can actually delineate an underlying causal diagram of what your question is of interest. And so I'm sharing this causal loop diagram that we produced from these workshops and the plenary because this really helped to shape the Harvest Share strategy. And we really rely on this underlying systems-based theory of change to design our program. So just to walk you through this is a lot to look at, but just in the most high-level terms, I'll walk you through some of the cycles within this diagram. So starting first with affordability of fresh produce. If fresh produce is more affordable, then it leads to an increase in being able to access culturally appropriate produce. Having access to this culturally appropriate produce can then increase somebody's well-being within an immigrant community. And then if they feel better because they're accessing this produce, there then increases a demand for this culturally appropriate produce. And that demand then leads to folks like Liz and Brooklyn Grange increasing the supply of culturally appropriate produce. And so this cycle continues around like this. Another example is having access to this culturally appropriate produce can reduce food waste, right? Because people are actually familiar with the food items that they are accessing. But food waste itself may be a way to activate the community because they want to avoid wasting resources and they want to avoid wasting food. So community activation can lead to community engagement, which can lead to, if focused in a similar direction as we're trying towards for collective action, a demand for culturally appropriate produce. And so all of this stuff that was enumerated within the purple circle is really, there are lessons that came out of the discussions because of the group model building workshops. And everything that is external to this circle are actually things that there are program features of Harvest Share that we co-developed with partners. So let me give you an example of this. So speaking again about the affordability of fresh produce, a couple ways that we can make fresh produce more affordable to lower income folks is to make sure that we accept SNAP within our program. And so that was something that's prioritized by, we partner with Brooklyn Grange and another farm. Both farms accept SNAP. And there are a lot of hurdles to do that for a small farm. We mentioned also, Darcy mentioned in her intro for Liz, the sliding scale. This is something that has been incorporated, and I'll talk a little bit more about this, but we also do subsidized cost for the box. On this side, in terms of community engagement, we have a community advisory board. We have 2, actually, one that is where the sessions are held, our meetings are held in Mandarin, and another one where our meetings are held in Spanish. And so we get feedback from our community advisory board, and this increases community engagement as well as community activation. In terms of, this is another feature actually that was a little hard to fit into this purple circle, but the cultural mismatch of provided produce can also lead to food waste within charitable food programs. And so what we did in terms of Harvest Share is we wanted to introduce nutrition education on unfamiliar produce, but we also, and this was something that both Liz and Katie at the table had experienced implementing a client choice model where people have a little bit more flexibility with the items that they're picking up from the farm. And so the idea is that the client choice model would lead to less of a cultural mismatch as well as a reduction in food waste. So you can see how the system that we developed together through discussion really helped to shape the foundation of this program. And then we were able to actually design other program features to really support this underlying system. So to go back to this diagram, so those two segments, the partner pivots and the group model building, is really just this one segment in terms of the multi-sector partners and all the different assessments that we did there. At the neighborhood level, we did a number of food retail environment audits in 2020, 2021, and 2023. And essentially what we found was that during the COVID-19 pandemic, restaurants, grocery stores, and produce vendors that were located in Chinese ethnic neighborhoods versus other neighborhoods were more likely to close. And we saw, we observed that 40% of fresh produce vendors were not operating during the COVID pandemic. What was promising was that in 2023, we found that produce vendors were rebounding and reopening, especially in the Chinese ethnic neighborhoods, but actually in different locations from where they were previously located. So that was very interesting. At the community member level, we did surveys. We also have done a number of in-depth interviews, and we've done a needs assessment. So from these different formative research activities, we've learned that there is an interest in locally grown vegetables amongst our immigrant community partners, where to grow. People are interested in where to grow their own vegetables, and also interested in an increased access to culturally relevant vegetables. As Jin also found in the literature, some barriers to program participation were transportation and language support, and not just language support within the recruitment phase, but really throughout the life course of the program implementation. Having that safe person that they can always speak to about program questions is really important. Food access was cited as a #1 challenge during the pandemic amongst the Asian and Latina communities. And in fact, 78% of Asian Americans have changed their behavior, such as grocery shopping, because of fear of racial discrimination. And then lastly, we mapped all of this formative research to the evidence and practice base. So we conducted a narrative review in 2021 of 19 different articles on community supported agriculture, or CSA, produce boxes. And so generally speaking, CSAs are shown to improve nutrition outcomes. Uptake has historically been amongst educated white women. And some of the barriers to participation for low-income individuals, for example, might be the fact that you need to do an upfront seasonal payment, which is often hundreds of dollars, and this is not feasible for many people who are lower income. And there also may be a lack of familiarity with the CSA model, and the drivers and motivators for participating amongst immigrant communities versus communities that have historically participated may differ. And so we need to consider all of these things if we're going to introduce a CSA model into the community. So the last piece in terms of formative work was we did run a pilot of this in 2022. So for this, we had capacity for 40 individuals, and we completed recruitment for this in 4 days. And I'll talk a little bit more about what the Harvest Share program engages in. 100% of people would recommend the program to others. 90% attended weekly pickup events, and 65% ate a greater variety of vegetables compared to baseline, which is really important in terms of diversity of microbiome. And 65% reported number of vegetables they didn't know how to prepare actually decreased. We also observed an increase in skin carotenoid scores by 39 units, which approximates to about 2/5 of a cup of vegetables. And for those of you who are not familiar, skin carotenoids are a validated biomarker of fruit and vegetable intake. Okay, so going back to the Harvest Share program, which is delineated by this circular diagram, from all of this formative work, we developed this initiative, which has 5 pillars. The 4 that we identified from the group model building, so food access, nutrition, education, experiential learning, and policy, but then also importantly, economic security, which we all know is an important driver of food access. So in terms of food access, what we have is a subsidized produce box that features Chinese or Mexican specific vegetables. We have the program capacity each growing season for 140 individuals. In terms of nutrition education, we have developed a number of in-language culturally appropriate recipe cards that are available in both Spanish and English and Chinese and English and Bangla and English on the same recipe card that also have vegetable prep information as well as nutrition information about the different vegetables. In terms of experiential learning, Liz and team have offered farm tours. We've done gardening workshops. We've done a number of cooking demonstrations, which are really popular. This is on the right is actually a new relationship that we have with a local Sunset Park restaurant where they came in and did a popiah making workshop at Brooklyn Grange. And we do a number of art sessions for children as well. In terms of policy, we have been trying to work in alignment with local food policy. So some of you may be aware that, for example, in New York State, the Medicaid 1115 waiver has been approved to cover food as medicine programs. And so we're kind of keeping our eye on that. What we do is not quite the definition of food as medicine in the sense that we don't have a referral from a provider, but we are keeping our eye on that to understand how that's all going to play out and work, and eventually try to plug into that. And then as you saw earlier, we've been working to document some of the social determinants of health that affect food access for immigrant communities. And then in terms of economic security, we have a focus on workforce development. One of our partners, Hot Bread Kitchen, focuses on workforce development for women, immigrant women specifically. I mentioned we have this new partnership with a small business owner, Hainan Chicken House in Sunset Park. And then we've been providing SNAP, WIC, and Medicaid information and recertification information in the different languages for our program participants. So just to give you a sense of how this produce box works in terms of the subsidy structure, this is, again, what we did for growing season 1. Now we're in growing season 2. And in this, Liz actually introduced a sliding scale model. So I'll talk about that in a minute. But the Brooklyn Grange box is grown at the Brooklyn Grange. It features Chinese produce. It's a 20-week program from June to November. We have the capacity to serve 100 people. It's a weekly share of about 5 vegetables. This is a picture that Liz actually took growing season 1, featuring some of the Chinese specific produce. It's a $25 value. The participant pays around $7 to $7.50. And as I mentioned, the accepted payments are SNAP, which can be weekly, or credit card for the whole season up front. And the recruitment has been through the Brooklyn Grange site and through our network of partners. And we do recruitment in all languages: English, Spanish, simplified Chinese, Mandarin, and Bangla. And then the Angel Family Farm box actually features Mexican produce. The capacity there is for 40 individuals or families. It's also a 20-week program. The weekly share also includes around 5 vegetables. It's a $30 value, and the participant pays $11. Similarly, we've worked really hard with Glenwood. Glenwood has provided a lot of technical assistance to Angel Family Farm to be able to set up their EBT reader. So they are able to accept SNAP, and they also do credit card for the whole season. And recruitment is through the Grown By site, set up with technical assistance from Glenwood. And we do recruitment for this in English, Spanish, and simplified Chinese and Mandarin. And so Liz can talk a lot more about this sliding scale model and how they went about developing this. For Harvest Share in particular, we worked really hard to think about how to best present this in such a way that would not be stigmatizing or that would make people feel re-triggered by trauma, thinking about their food insecurity. And so there was a lot of thought that went into the tiers, how to name them, should we do colors? What color should they be? What the pricing strategy should be. So this is the current model that we have introduced for the Brooklyn Grange side in terms of sliding scale. And we think that this is an important way, not only to build community amongst the members that are participating, but to also think about the sustainability of this program in the longer term. Okay, so this is a slide that depicts just one portion of the Harvest Share evaluation. So as I mentioned, we recruited 140 participants in year 1, or the 2023 growing season. These folks were recruited from Sunset Park and nearby Kensington, Brooklyn. And in parallel, we have recruited comparison community participants from Mott Haven, South Bronx, Flushing, and Manhattan Chinatown. And we will be doing pre-post evaluations of the Harvest Share participants and the comparison community participants. And we repeat this design every year for years 2 through 5. And at the end, we'll be doing a combined analysis across all 5 years. At each time point, the participant completes a survey as well as a veggie meter reading, and they receive a monetary incentive. And the survey questions also include a number of items on vegetable intake, food insufficiency, stress, happiness, and ethnic identity. Okay, just to continue in terms of evaluation, in addition to the quantitative individual level evaluation, we do qualitative work. So in spring of 2023, we did an assessment of the cultural mismatch in local food distribution programs. In the fall of 2023, so I'll share, and I'm happy to take lots of questions about this. I mentioned that our program is available in Bangla, and we actually worked with a close colleague of mine who has worked with the Bangladeshi community in New York City for 20 years. And we recruited exactly 0 Bangladeshi participants into this program, despite the fact that we were going through these trusted channels and working with local mosques. And so we really wanted to understand why this happened. And so we did a number of community interviews. Just spoiler alert, we're preparing these final things now. We've done a number of activities for the Bangladeshi community, but it turns out that they're less interested in receiving produce, and they're more interested in growing it themselves. And the Bangladeshi culture has a really rich culture of home gardening and organic produce. And so I think it was really great that we were able to figure that out. And so, and then Liz worked really hard this spring to introduce a seedling initiative, which again, they can share more about. In fall of 2023, we also did a partner evaluation and a social network analysis within the partners. The social network analysis was funded by a diversity supplement to this R01, which was awarded to Dr. Landone at NYU. And so she's been working on that and learning the methods. In spring of 2024, we did interviews amongst BASIS participants to understand some of the unmeasured benefits of program participation. We also held an art-based evaluation amongst participants with some mixed reception, definitely more popular amongst the families, but that was an interesting experience. And then this fall, actually on Tuesday, we're going to be doing ripple effect mapping sessions. So ripple effect mapping is a qualitative research method where you can understand not just the impact of a program on an individual level, but also assess it at the community and societal levels as well. And then in winter of 2026, we'll be repeating the partner evaluation. In terms of community level data, I mentioned the food retail audits that we did in terms of assessment of produce vendors. We'll be repeating this in spring of 2025. In summer of 2023, we also did a produce item price audit. So on the right-hand side of the slide, we did a quick survey amongst our participants and asked them what their top stores were in the Sunset Park area. And amongst the selection of them, I think we ended up landing on the stores that are in bold. There was actually an in-depth assessment done of the different produce that were available and the pricing, and the price analysis actually is being done now. I think it's almost complete. So we'll have a better sense of what the prices are like for some of these produce items, or if they're even available within local stores in Sunset Park. In terms of administrative data, the last piece is to do comparison of measures with the New York City Community Health Survey neighborhood data, which is essentially, you could think of it as a New York City regional BRFIS or behavioral risk factor surveillance survey. And we'll be looking at things like fruit vegetable intake and self-rated health in Sunset Park, as well as our comparison communities. Okay, so I just wanted to pause and share this. I really like this example because I think it shows the level of dedication that our partners have and the level of thought that we put into the way that we design a lot of our program elements. So in collaboration with our partners, we created this community-facing name and tagline. So, as I mentioned, the R01 for this is BASIS. basis kind of had no meaning within the community. It didn't really have a ring. And so I'm sure many of you have had experience. You create a community facing name. So this took us, I would say, like about a month or two to figure out the best name, not only in English, but then the tagline. And we wanted to keep in mind that this needed to be salient in the 4 different languages that were spoken amongst our community members. And so you can see that the translation of Harvest Share differs a little bit for the Chinese, the Spanish, and for the Bangla names. But all versions convey, we think, the same broad messaging, and each is also specific enough that allows for the community members to feel seen and connected to this program. And so this really, I think, with just the name, it encapsulates a lot of the essence of the work that goes into, I would say, every single component of this program. Okay, so just a few other updates. I did mention that we launched a Bangladeshi community seedling program. This was a wonderful effort led by Liz and Brooklyn Grange folks in terms of gathering information from the Bangladeshi community on their preferences for what kinds of seedlings they wanted to see, and then going ahead, purchasing those seeds and growing all the little seedlings within the nursery at Brooklyn Grange. We are also in the process of launching a number of pilot studies to support the comparison communities and community partners. So I will share that one of the pieces of feedback that we received in the R01 review was well, what are you doing for the comparison communities? And that always stuck on my conscience, of course, because as a community engaged researcher, and I really prioritize not being an extractive academic. And so we're actually launching, we're investing in a bunch of pilot studies. In Flushing, there's actually been, the folks that have been the most engaged tend to be older women that are Chinese, and they've expressed an interest in learning more about bone health and vitamin D. And so we're going to be working with a registered dietitian to develop some programming for them there. In Manhattan, Chinatown, the folks that we tend to reach are middle-aged working mothers. And so there we want to explore a mother's box where we actually do delivery to either their early childcare center or their homes, provide children's books that are in language with some social emotional learning materials. We have a new partner named Curio who's going to be providing those materials. So, and we'll also be providing them with culturally appropriate whole grains and recipes. And then Glenwood actually came to us and expressed interest in putting out a pilot or investigating more of what we could do around the health of farmers within the Glenwood network in the Hudson River Valley. And so we were able to secure a DEIA or Diversity, Equity, Inclusion supplement from the NIH to launch this farmer health program. So we're really excited about that. And then we've been working hard to identify lots of gaps in the literature. In doing this work, we realized that there's actually not a lot of understanding in terms of Asian American diet in the United States and what Asian American communities eat, especially across all the different ethnic groups that are represented in that umbrella term. So we are doing a systematic review. We've also noticed that there is a lack of specificity in the Latina American research space, particularly for those groups that are the groups other than Mexican, so Dominican and Cuban. And there's one NHLBI funded study that focuses on Hispanic ethnic groups, but the majority of the literature really is just Hispanic and Latina, and we think there's space for more specificity. And we've been working a lot on our inclusive research approach. I won't go into detail with this here just in the interest of time, but this is a 3-step process that we propose for more inclusive research. Harvest Share is a great example of the application of all these different factors. Again, I won't go into it in detail here, but happy to answer some questions about it. And then just in terms of our acknowledgement and funding, I just wanted to acknowledge the core team from NYU, as well as all the partner organizations. And I will look forward to Q&A, but now I will turn it over to Liz.
Thank you so much, Stella, and hi, everyone. I always get excited kind of getting a recap of this program because it really does cover so much. So my name is Liz and I am the partnerships project manager over at Brooklyn Grange. We are a rooftop farm business that was founded in 2010. We currently have 2 rooftop farms that span about 5 acres, and we host farmers markets, a sliding scale CSA program, as well as our equitable food distribution program. So we grow about 80,000 pounds of produce every year, and about 60% of our annual yields go to New Yorkers at no or low cost. So that's kind of where we are today. But as Stella mentioned, it was not always that way. Pre-pandemic in 2019, about 70% of all of our produce went to high-end restaurants and specialty grocers in Manhattan and Brooklyn. You know, we were hand-picking about 24 different varieties of edible flowers to garnish these Michelin star plates. And you know, we were proud to do that also because that allowed us to ensure that we were paying our farmers an equitable wage. And as a urban farming business, that was really important to figure out how we were going to strike that balance. We do have 2 other arms of our business. So we are not just a farming business. We also have an events and landscaping business, which also help support the work that we're doing. But I do remember March of 2020, you know, when just suddenly the restaurants were shuttering their doors. We had just spent all winter, you know, fine tuning our crop plan, and quite literally overnight, we needed to scrap the whole plan and come up with something different, something that was going to serve our community and that was going to fill bellies. It was a whirlwind experience, and I know everyone has their own story. I think for myself and the farm team, it really was an opportunity as an essential worker to you know, try to think in the future of what is going to be this emergency food relief obstacle. So at the time, we started a partnership with the Table Food Pantry. It's a client choice pantry, as Stella mentioned. And in 2019, we started serving 100 families through kind of a market style food pantry. In 2020, during the peak of the pandemic, that shifted to over 850 families. So we were trying to think of sustenance. So pivoting to growing, you know, dime-sized turnips that chefs wanted just right, to, you know, potatoes and onions. We also shifted and expanded our CSA program and began delivering CSAs to apartment buildings and to different locations in communities. So those were some of the adjustments that we made. We also have this massive greenhouse that we at the time were growing microgreens, you know, these adorable little garnishes that chefs paid top dollar for. All that closed overnight, immediately, whole program shut down. So we had this empty greenhouse, and we, you know, started to hear about all these, you know, calling them victory gardens, all these gardens that folks were starting to, you know, utilize, both in terms of having access to green space, but really, you know, having some agency and growing food for themselves. So we were able to grow, you know, a few hundred seedlings and get them out to some community members, including community members at Myrtle Village Green, which is one of the largest community gardens in New York City. They have about 150 different members, most of which are either Bangladeshi, Mexican, or, you know, any other combination of the diversity that we celebrate in Brooklyn. So we got them lots of seedlings. That was 2020. In 2021, we kind of went back and we said, okay, we've got a little more time now. We'd love to continue this partnership and to serve you. What types of crops would you like? Give us some feedback. We got a little bit of feedback. We like fine-tuned our plan just a little bit. Then, 2022, we came back, again, building that trust, taking that time, learning these community members. We started to get, Ziploc bags of seeds that, were just like family heirlooms. It was really touching. And it was such a like trust exchange. Like, I'm giving you these precious seeds that my family has been holding on to, grow them, and like, let's help us continue this partnership. So that was 2022. And then following year, that was when, working with Stella and Harvest Share, we wanted to expand this work to the Bangladeshi community. And so we asked our friends there and said, would you be willing to participate in an interview? We really want to get some more feedback on, how we can serve the community, whether that's, with this Harvest Share program and CSAs, and what types of food would you like? And I was really struck, and that's why I'm sharing this example, is because rather than say, great, these are some foods that we'd love to see, maybe we'll see you at the CSA pickup. Instead, we had built this trust where giving honest feedback and saying, a CSA program's really not resonating with our community. We actually prefer to grow our own food, and having that connection point, having those morning waterings and harvests together, that's actually what really helps our community thrive. So being able to get feedback that took us in a totally different direction. And now we are able to move forward and continue this seedling project where we're growing, sourcing these seeds, getting support where to source them, getting the insider scoop of which bodega has, the best pepita seeds, and really being able to show up, I think, in a more meaningful way, and to be able to leverage this resource that we have of this, huge greenhouse in New York City. So I think just emphasizing that having time to really develop these relationships, and that's something that excited me about this program with Harvest Share, it being a 5-year program that is going to go on, and we're working out ways like our sliding scale model to ensure that it is able to sustain itself, but working in collaboration with these community partners and taking time in the community. We have one of our farmers who is quadlingual and is able to, sit at the table at the food pantry and just be a familiar face and not have an ask, not trying to kind of extract from the community, but rather just to be a familiar, friendly face and just to listen. And eventually over time, we've really been able to observe from this client choice model, okay, which produce items are not being picked up? Okay, let's change. Or hearing and talking with, different members that, she sees every other week. Okay, so you'd like to see more of this, and being able to really fine tune and custom make these crop plans that ensure that the fields are actually mirroring our community. I could go on and on, but I do want to be mindful of time and allowing for some folks to ask questions. And so we can dive in a little deeper on the things that most interests and might support your work. So maybe I will pause and open it up for questions, or pass back to Darcy or Linnea.
Yeah, I'll start off. I mean, first of all, amazing work. So many pieces of the puzzle coming together. And I was curious, how do you all make decisions about when you would say, yes, we're going to add on a new element, or no, we don't have the capacity to do that? Because it seems like you could have endless potential of pivots. And I was just curious, how do you balance out like the opportunities to further tailor and existing capacity and resources?
Stella, do you want me to take that one?
Yeah, go ahead.
Sure. So that's a great question. And I think that kind of riffing off this point of slowly building trust is for me, you know, I love being a thought partner in all of this work, and I, you know, love rattling around different ideas. But now that we're at the point where participants in our program and community members are stepping forward with ideas and actually becoming workshop instructors, I think we are like at this sweet tipping point where now we're realizing, like, letting community members start to lead this work. That's where I think we're more apt to kind of really emphasize. So we've been doing a lot of the legwork of generating excitement around this program and building this, you know, structure, and being patient to let kind of that feedback in. And now we're starting to see that that's happening, and businesses are coming forward and leading the work, who have been connected in the community for their whole lives or many decades. Yeah.
Yeah, and I can just add, Darcy, from the academic perspective, there's always a lot going on in terms of the funding streams and like new grants that are available that can be applied for to, you know, together in partnership. And so a lot of what we do, what my team does, is we do a lot of listening. You know, as I mentioned, like the pilots that are being introduced, those actually leverage, the Flushing one in particular leverages community interest and like who the folks are that continually come back and are engaged in the Harvest Share surveys. And then the Mother's Box program, for example, that actually builds on a program that is prioritized by CBC Manhattan in terms of social emotional learning and supporting families with books. And it just really aligned well with the ethos of what we were already doing for Harvest Share and some of the new partners we had. So I would say that in general, you know, those are very specific examples, but even in the relationship with Liz and with Brooklyn Grange, there's just so much listening that goes on both sides. And I think when there are disagreements in terms of prioritization or approach or, you know, other components, it's just a discussion. I mean, just like in any kind of relationship that you have personally or professionally, you have to talk it out and be upfront with each other. And so, yeah, I think our team does a really good job. You know, Liz can reflect on this, but I think as a group, our team does a really good job of listening. Everyone is very respectful. There's a lot of trust. You know, Liz and I started talking to each other in 2019 before any of this craziness happened. And so it does take a lot of time, but it really, I think that's one thing that's to be said about community-based engaged research is especially from the academic side. I just think you have to have a lot of people skills and a lot of EQ to just sort of read the room. And I think that's something that's never spoken about in classrooms. But I certainly think that's taken us a long way.
So it looks like we have a question in the chat from Carlos. If you would like to read or share your question, Carlos, you can unmute, or we can just read it out loud.
Thank you. Yeah, I wasn't sure, and I have some construction in the background, so if that gets a little messy, I can go back to mute. So I have a background in public health and urban agriculture in Chicago and did some work in California. Never really broke through on that connective tissue with like working with like medical groups and having them intertwined with urban ag programs. So this is a really amazing, awesome partnership and story. So my question is on the partnership itself, and like I was saying, and there just what were some initial barriers outside of the pandemic, right? And that is a barrier all on its own, but just in getting NYU, Langone, and getting Brooklyn Grange, getting these two different systems to work together, what were some difficulties on that end? And and then if you can expand, if other hospital groups or medical groups have approached either of you, either side, to see if there's potential for collaboration there. Thanks.
Liz, did you want to start or I can go first?
Why don't you start this one?
Okay. I think one thing that might be helpful to know contextually, Carlos, is that the department that I'm in it happens to be in a school of medicine, it happens to be in an academic teaching hospital, but it's the Department of Population Health. So like our department is within a school of medicine, but there's about 140 faculty, and it's almost like a school of public health within a school of medicine. So I would say that the uptake of food as medicine programs and farm partnerships is a little dicier within our health system versus our department. So I think that's an important distinction to make. Liz and I have had some interesting conversations where, clinicians kind of want to treat it as like, well, where can I triage people? Like, why would I send them to your program kind of feeling versus like, building a partnership together. And so it's the public health side of things that I think enabled that. There are lots of barriers to working within a health system. Like we were actually, this is again, a tiny example, but just to give you a sense of it is an ongoing thing that happens. Like we've been working together for 5 years, but every year we plan a block party for Harvest Share and in Sunset Park, and the team, Liz last year had the great idea to have a bouncy house and a generator. And then, this year NYU is saying like, well, NYU can't sponsor a bouncy house because it's a liability if somebody gets injured and you need to put in this, request. You should have done it 6 months ago. And so we just turn to Liz and we say, Liz, can Brooklyn Grange do the bouncy house for us? Because NYU is giving us lots of red tape. So I think there are pitfalls and benefits to working together. I would say that the population health focus and the community engaged focus of our department is part of the reason why it makes us successful. But I just did want to mention that there is a huge amount of interest that's actually organized by the Rodale Institute. They just had their conference this past fall, but they have a big interest in connecting farms directly with healthcare systems. And I think there's an example, for example, in Pennsylvania, where the hospital actually has its own farm and actually pays for its own farm, which supplies a CSA for their medical students. All the food that is for the hospital cafeteria is grown on that farm. And so we did have a dream of bringing something like that to NYU Langone, and we did try to have some conversations in it. Maybe like you, Carlos, it went nowhere. But we've been able to build this on the research side. I'll pause there, Liz, in case you wanted to add anything. Sorry, that was a lot. Now it's 10 o'clock.
I mean, I guess I'll quickly chime in and say that I think that it was really critical that as a farm partner that we set some clear boundaries of what was going to work and what was not going to work for our farm operations. And that was really respected, and we were able to move forward with that. And we've always kind of been heard as experts in our field, and how critical that is in order to be able to sustain this work.
Carlos, I just saw I think it was New England Journal, there's a new model that they're sharing that is like farm and hospital, and it's a really nice model. And I actually had just sent it to Liz because I was like, how did they scale this? It's like now serving like thousands of people. If I can send it along to Darcy and Linnea and to forward to you, but it is in the Chicago area and they've had a lot of success.
Great. Yeah, we can, so after today, we'll send the recording and the slides and any links. So Stella and Liz, if you have any other links to share with everybody, we'll send those out in an email by next week. We are at time, but thank you all so much for presenting today. It's a really unique, exciting program that you've got going on there. And yeah, we hope to stay connected, and yeah, we'll be sharing everything with everybody by email. So thank you both so much.
Great, thank you. Bye.
Bye.
Thanks,
Have a good day.